can put it in a flow chart. So normally the grade 2 and the grade 3 injuries lead us to the rehabilitation. I've seen players more than rushing to the toilets, they're rushing to the physio. They're standing in queue for the taping. So how do the physio earn the trust of a player who is going through injuries? The coach, the captain says no, he needs to play, but your thought is otherwise. So how do you also work as a team? I mean, the teamwork between you, the coach, and the captain. Because we as umpires have seen few players who are carrying injuries from their previous games. They are just taping, they are putting plasters, they are playing. Hello, friends. Welcome back to our channel, Life Beyond 22 Yards. So, today again, we have come up with an interesting topic which again revolves around a sportsman or an athlete. So, as we all know, we have discussed previously a life of a sportsman or a career of a sportsman is very short compared to other professions. So, constantly is fighting battles. A sportsman is fighting battles within himself and outside. So, what we understand, the two prime battles which he always fights is maximizing his performance, being in this best of his form, and the other thing is minimizing his injuries and making sure it does not hamper his performance or his tenure of playing. So, today we will be discussing about a topic related to the injuries, the basic idea of understanding what are the things an player goes through when what is injury, what are the types of injuries. So basically our topic is injury management and rehabilitation. So to enlighten us more about this topic, we have with us Dr. Amit Hosur. Dr. Amit, welcome to our show. Thank you. It was great of you when we approached you. You said you are available despite of your busy schedule. Thank you for making time for us. So quickly, I want to introduce Dr. Amit. Even though he's a very well-known name in the sports circle. So Dr. Amit is a level one BCCI certified or BCCI accredited physiotherapist since 2017. Dr. Amit is also worked with the Central Zone team in the BCCI Interzonal Games. Dr. Amit is currently the chief physio for Karnataka State Cricket Association Dharwad Zone. And more importantly, the highlight is Dr. Amit is a certified sports taping practitioner with an experience of 20 plus years. So when we go through his profile, we felt that he can be the best person who can tell us more or give us more information about the injury part and the rehabilitation part. So, Amit, once again, welcome to the show. To start with, we know the players go, so like injuries do happen to the players and athletes. So in the technical terms, I think you call it grade 1, grade 2, grade 3 injuries. So what are these injuries? How do you differentiate these injuries? Is it based on the dynamics of the game or an event, or is it based on the individual's BMI or the muscle structure? What is it about?
Yeah, severity of the injury or the dynamic of the injury can be has a different factors.
Okay.
One, severity of the this one, how bad the injury is. Like as you said, like grade 1, grade 2, and grade 3. Grade 1 is just a basic sprain, where still a player can get into the game after certain first aids like taping and icing and compression therapy. You can still go into the game immediately or maybe an hour after an hour. That is
Okay.
grade 1.
Okay.
Grade 2 is something like partial tear or partial tear of the ligament, or these where there is too much of swelling or severe pain, where we may or may not put him back onto the field immediately.
Okay.
He may need a bit of rehab part, but not to that extent
Mhm.
as compared to the grade 3, where you have got a complete tear of the ligament or complete fracture of the bone, or there is any head injury, where absolutely we bring the player out of the ground and we assess him medically, and there we say that that is grade 3, where he needs a prolonged rehabilitation part. That is one way of dividing the injury part. The other factor for this injury is type of game,
Okay.
whether the player is type of the game, in the sense like whether it is the player is playing contact sports or non-contact sports.
Okay.
Non-contact sports is somewhere like badminton, or some for a while cricket,
Mm-hmm.
or for a while lawn tennis. These are all non-contact sports.
Okay.
And contact sports, completely contact sports, are football, basketball, rugby. These are all the completely the contact sports. So the severity of the injury or the percentage of the injury is less in the non-contact sports,
Okay.
and the nature of the injury is also different in the non-contact sports, where in the during especially the non-contact sports, we the injuries are of the overuse injury. We call them as the overuse injuries. For example, a tennis player who is constantly serving,
Mhm.
there, because of the overuse of the shoulder, he may tear
Okay.
his a tendon in the shoulder.
Mhm.
So whereas in case of the contact sports, where you come for the football, where you come in contact with the other opposite player very frequently, there the nature of injury is different. There you can have directly the fracture or collision with each other, leading to
Oh.
head injury,
Okay.
or even the a complete ACL tear. So this is the way we divide the computer the injury according to the type of game. And the third is like the environment of the game
Hmm.
where you are playing.
Okay.
It can be the environment, in the sense like whether you're playing in the hot sun, or
Mhm.
we're playing in the this one very chill climate, or whether you're playing in the continental climate. So in case of hot, you end up with a too much of dehydration, that ends up with the cramps. Or in case of cold climate, if you are playing, if for example the ball hits, you may end up with a frostbite,
Okay.
or you may end up with the even the small finger injury, where the rehabilitation will be slow.
Okay.
That is one way of dividing this one. Even where you are playing at your turf,
The surface.
surface of the game,
Okay.
whether you are playing on the grass surface, whether you are playing on the artificial turf, or whether playing in the mud. So there also, according to the nature of the this one
Surface.
surface,
Mhm.
there also the injury pattern changes.
Okay.
And lastly, even the your equipments, the
Mhm.
equipments what you are using for that particular game.
Mhm.
For example, in the cricket, you are
Mhm.
using the helmet with
Helmet.
the guard,
Mhm.
and you are using the pads. And for example, even if the ball hits your guard, sometimes that breaks up, and it may hit your
Correct.
eyes,
The
or
impact can still
impact
be more.
still be more.
Yep.
So whereas in case of on the contrary, the badminton, where you don't have any this one instruments or
Uh-huh.
any game gadgets,
Yeah.
so there the that injury from that part is
Is
less.
slightly lesser. Yeah.
Less.
Okay.
So this is how we divide, or we grade the injuries
Okay.
on the different factors.
Okay. So very nicely you gave us an in-depth information about how do you analyze as a professional, you analyze the injuries. So if I understood it correctly, if we can put it in a flow chart, so normally the grade 2 and the grade 3 injuries lead us to the rehabilitation. So how do we understand, or what do we feel, or what should we do about the importance of a rehabilitation? Is it important?
Definitely, it is important right from the grade 1 to grade 3. If there is any injury, you have to go with the rehabilitation.
Okay.
But that rehabilitation depends on the injury level. Whether it's
Okay.
a grade 1 injury, grade 2 injury, or grade 3 injury, that rehabilitation protocol changes
Mhm.
depending on the grade of the injury. So why we need a rehabilitation part is, like, one post injury, your muscle strength declines, and your there will be severe pain, there will be severe swelling during because by this rehabilitation, the pain comes down fast, your the performance of the muscle improves faster, and your back to game
Mhm.
timing will decline drastically. So we need that. That is one reason we need a rehab part. And second is like, as I said, like for example, in the grade, let me take the example of the grade 3 where there is a ACL injury. When there is a surgery complete tear, after complete tear, there is a different graft has been used to for use of the ACL. So during that process, we need to teach the graph, the new graph, the action of the ACL. It is called re-educating the
Okay.
graft.
Okay.
So during that process, the healing process also will be delayed,
Okay.
and the re-educating the graft, plus not only the strength part, even the coordination part of the between the your injured and the your neuromuscular system.
Okay.
That is called the coordination between the this one, the injury, the ligament and this one, that has to be improved. And your biomechanics changes, your biomechanics of the activity changes post injury.
Okay.
So that has to be brought into line, so that we need to improve the biomechanics of the action
Okay.
of that particular limb. That is one. And during this process, you can even improve your old wrong technique, because of which you have been injured. For example, in case of shoulder injury in the ballers, it can also be because of a wrong technique which you have been using from pretty long time. Because of that overuse, you have torn the tendon.
Okay.
So during this process of rehab, we even teach, or even the coach also can come into handy to improve his technique,
Yeah.
so that the same injury should not
Occur.
occur once again.
Okay.
So for all these reasons, we need to go for the rehab part. And the main important is like re-injury percentage falls down drastically if you follow the proper protocol of the rehab part.
Superb. Superb. So we understood what is the importance of rehabilitation. So definitely, guys listening to this, do not ignore rehabilitation. Now, as you rightly brought in the situation of the player, the coach. So let me ask you something interesting. You have worked in as a physio in a cricket team. So if you come across a player, let's take an example. We come across a player whom you feel is injured. Let's say level one, level two, but the team is in a very critical situation where he is a prime player and he needs to be playing to win them the game. So the coach, the captain says no, he needs to play, but your thought is otherwise. So how do you also work as a team? I mean the teamwork between you, the coach, and the captain.
See, even my as a team physio, my aim also will be there. Will be to put him back onto the being a important player. My aim will also be to bring him back to the ground.
Okay.
Uh, but depending on the severity of the injury. So, considering that what level of the, if it is, as you said, the level two, if I put him into the ground, I assess him what will be the impact on the injury, and later on how far we need to put him aside, because of one game. He cannot put his career or put his next tournaments or next games into confusion.
Okay.
So we will make the coach and the captain understand these are the drawbacks at this level of injury. If I put him on the ground, these are the things you may come across at the end of the game.
Okay.
So you may make him play this by some aids or some taping or some first aids and all. We may push him on the tablets or inflammatory drugs. We may put him on the ground at this,
Okay.
but later on, its impact you may lose for 3 games.
Yep.
So what you want?
Definitely. We have come across these situations because we as umpires have seen few players who are carrying injuries from their previous games. They are just taping, they are putting plasters, they're playing. As soon as they finish the end of a session, again they go back, they immediately rush to. I've seen players more than rushing to the toilets, they're rushing to the physio. They're standing in queue for the taping. So now I'm able to recollect what you're saying, and uh, basically it's the leverage up to what extent as a physio is you're permitting him to play.
Yeah. So even it depends on uh, another factor. We can push him to the ground depending on the what player he is.
Okay.
and what player he is, and what is where is the site of injury.
Okay.
For example, if he's a bowler and if he has injured his shoulder, then I cannot push him, because he's being a fast bowler or the spin bowler, though is important. He has injured his shoulder, and shoulder itself is a main this one
Weapon of the
weapon
bowler.
of the bowler. I cannot push him anymore
Correct.
into the injury. But if the ball, if the any middle order batsman, if he has injured his shoulder, or if he has injured his any of his abdomen part, I can take a risk and push him to the, if he is an important player
Okay.
in the middle order,
Okay.
and the site of injury is somewhere in these areas. I can ask the captain, okay, I can make him ready for the game, but with the certain conditions, like see to him that he don't get stressed too much of getting the ball,
Okay.
or you don't get put him in such a place that where he need to not run too much to the boundary and not stressed. He's only directly, he should see to it that he comes to his batting part or his role,
Okay.
and stress him more on his role part, and then get him back.
Okay,
So
but
that is
umpires do not allow substitutes for these things.
yeah,
Just on a lighter note.
yeah. Umpires don't allow substitute,
Yeah.
but you can put that player in a such a some different position
Where the ball seldom goes.
where seldom goes.
Yeah.
So that he's stressed less during the fielding,
Yeah.
and directly you can bring him to the batting in his order.
Very nicely, very practically explained how actually the support staff works. Very nice. So now between all this, one question came in my mind. How do the physio earn the trust of a player who is going through injuries, or who is not, he wants to get on the field, but injuries is holding him back. So how do you earn the trust of a player?
See, basically, being a physio, you have to be very clear about the injury.
Okay.
Make the athlete or the player understand what is his grade of injury, what is the severity of his injury, and how much it will take time to get back to the ground.
Okay.
So don't you hide him, or don't unnecessarily give him the false hopes, or give him the goals in a practical way.
Okay.
You cannot just say that when it is a grade 3, no worries, you can just within 4 to 5 weeks you can get into the game, don't worry, I will take care. No, if you give him a false hopes, then there your this one trust falls on. That is definitely, whether me or you, anybody, that in grade 3 nobody goes into the game within 4 to 5 weeks. You need a lot of rehab part which takes 6 months together. So don't give such a false hopes, or don't keep impractical goals.
Yeah.
So always keep with the constant communicate with the player, and give him a fair idea or a clear idea about the injury and how when he is going to come.
Okay.
That is one thing. And if a player knows about you, about your skills, where you have been using with the previous players or other players, and he has come back to the field, with your good skills, it has come back, and if he knows that, then he will trust you. I know him in the past, he has treated that player very well, so he can handle me properly. That is second best thing. And third thing is, don't only just talk with the player after the injury, or only during the injury. Don't talk with him. Even after the rehabilitation part, talk with him about the other parts of the well-being.
Okay.
Don't just talk about if he has injured his knee. Don't only ask him about the how is your knee, are you doing good with the knee, is there any problem with the knee. Don't do that. If you keep on asking about to the player about overall well-being, is there any other problem, are you okay with the your fitness part, are you okay with the, you had asked some, you had some problem, small niggle in the past with some this area, are you okay with that, do you need my help? If you keep on communicating, if you keep on boosting it, that trust develops, that bonding develops between the physio and the player.
Super. It's not only the subject matter which earns you trust, but it's also the interpersonal skills. To become a good physio or any professional, you need to be also, you also need to be a good human being.
definitely.
and trust the, and be very transparent and be honest with the thing. So very nicely he said. So in this short span of time, I think myself and my viewers have understood a lot of things. What an injury is. It's not, any injury is not a light injury. We cannot take it very lightly. So many things undergo inside our body which we are not aware of. So very nicely, Dr. Amit has explained us very nicely. Amit, just last thing, many of our viewers are sportsmen, active sportsmen. So, any piece of advice you would like to give it to our viewers?
Definitely. One is like any player for that matter, when he has reached, whether it is a I mean, just started or he is into the international level.
Hmm.
Always, I say, according to me, is listen to your body.
Okay.
Whether it's a small pain or small niggle, don't neglect it.
Hmm.
If you neglect it, thinking that it's a small, we keep on loading it and don't listen what the body is telling. Boss, I am injured, please do something for me. The body is telling you by the pain or by the swelling or by the certain restriction of the movements, or maybe because of all this your performance is not up to the mark on the ground.
Yeah.
So all these things are telling you, your body is telling you are not up to the you up to the mark, and you try to do something to me, heal me.
Yes.
So listen to it,
Mhm.
don't ignore it. And second thing, understand your body system,
Okay.
basic body system. Understand your basic body system, maybe with the previous injury of your own or previous injuries of your colleagues.
Okay.
Seeing to that you understand and also understand your body, and
Mhm.
accordingly you treat it. That
Yeah.
is second thing. And third most important is your fitness part.
Hmm.
Whether it is a off season or on season, communicate with your physio or communicate with your trainer and make a proper chart. And during that process, how the off season this one has to be, and how the during the season, how what are the exercise to be done, or what are the to keep yourself fit, what are the things and how much to do, how frequently it has to be done. Make a proper chart,
Okay.
consulting your physio, and follow that properly, so that when you come to the ground during the season, you are ready for the game. That is third. Fourth, whether you are a ground level player or the international player, basic things like warm up and cool down never changes for anybody.
Okay.
Never changes for anybody. So this has to be practiced religiously to avoid any injuries.
Yeah.
And fourth one, don't jump the this one protocol of the rehab part.
Hmm.
Just you have been injured,
Mm.
so I after 2 months or 3 months you have got a game, and you are badly injured. Don't jump the this one protocols or rehabilitation protocols from stage 1 to stage 3, stage 5, just because you want to end up in the game on that day.
Okay.
So you have to, however urgent you are in the game, or however lightly injured or severely injured, you have to follow the this one rehabilitation part. Please don't skip that. And don't push yourself. And in another layman term, we call it as a don't be a hero of yourself.
Okay.
Okay, I can do that.
Mm.
I can do that. It's nothing. I can do that. Please don't do that.
Hmm.
Just keep that one
Yes.
low and go according to the scientific way
Mm.
of rehabilitation part, or scientific way of approaching that particular injury.
Yeah.
Or if not the injury, approach your proper body scientific in a scientific way, and keep yourself fit all throughout the season or off season. And that will help you through that will increase your lifespan.
Yeah.
Because of fitness, I feel for any athlete, two things are very important. One is fitness, another is skill. You have got a good skill, but
Mm.
you don't have a fitness, then that skill goes into waste.
Yeah.
And you have got a good fitness, but you don't have a skill, in spite of standing there for 6 hours on the ground, if you can't perform, that is also waste. So I believe his skill and fitness goes hand in hand
Okay.
to bring the his any athlete's life to the longer extent without injury or less percentage of injuries, and any further hurdles in his athletic life.
Uh, Honestly, I'm feeling wonderful uh, after discussing with Amit. You have actually enlightened us honestly on so many aspects, not only injuries, be it how to approach a game, how to approach our body, how to listen to our body. It was fantastic understanding ourselves through you. So thank you very much. On behalf of all my viewers, I thank Dr. Amit Hosur once again for a valuable time. And from the all my friends, on behalf of all my friends, I wish you all the best for all your upcoming assignments. We will again meet up in some upcoming discussions. Till then, all the best. Thank you very much once
Thank
again.
you. I'm
Thank
always
you.
there. Thank you.
Thank you.